Unfortunately, what I've seen is the focus of nurse practitioner training is not caring for the patient and helping the whole team. It is about advocating for money, honest to God. I mean, I hate to say this directly, but this is what I see. So the difference in the students who came to me who are nurse practitioners were at the beginning, they wanted to learn everything they could about helping the physicians, meaning me, who is training them in what they do. The difference now is I've stopped training them because of all this. I've got to tell you, because it's just, I can't anymore. Because they come in, they want me to sign off on hours they didn't even show up in the clinic. And this is not just one or two, this was all of them. Oh, but I had to do something or other else, so I couldn't come in. I'm sorry, that doesn't count for your hours here. And when I would give them assignments to do, meaning, go home and look at this, study this, understand why you would want to be able to help with the team doing this, 9 times out of 10, they'd come back and say, oh, I didn't have time. Because why? Oh, well, I was working as well. They were in the hospitals working. But you're going to get qualified without any kind of background training. This is terrifying to me. They come out of these programs doing an exam now. In the old days, their exams were nurse practitioner based, understanding how to help, understanding to explain things. It's not anymore. Now they can pick up the answers online. Literally, they can sit at their home and they can look up things as they're doing the test. And the test is, I'm sorry, I've seen the testing. It's a joke. It's an absolute joke. If you look at medicine, if you look at nursing, I understand it. And I'm not saying what they're learning is a joke, but it is if they're going to act as physicians, which is what they're trying to do. And the other side of it that I wanted to mention, another reason why I stopped training them, is because in the first days of training, when I first trained nurse practitioners, they wanted to work with patients. They wanted to help. They wanted to be part of a team. Every single nurse practitioner that I was training, when I was asking them what they wanted to do, the money was the only thing they were looking at. They wanted to go into mostly aesthetics because that's where the big money was. Well, I just want to say there are wonderful nurse practitioners and PAs. There are people who know their place as part of a team, not under, over, or even sideways. We are not in competition. We need to be part of a team. It's not about any kind of competition on disliking them. There's no dislike. I dislike the advertising that they're putting out, and their miscommunication about what their credentials are and what they're capable of understanding and doing.
If you'd like to learn more, I encourage you to get the book, Patients at Risk, and the follow-up, Imposter Doctors. And if you're a physician and you'd like to learn more about getting involved, join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org.